Here in this afternoon, we want to focus on the unique mental health challenges facing older adults. May is Mental Health Awareness Month. It is also Older Americans Month as well. According to the World Health Organization, roughly 14% of adults over 60 are living with a mental health condition, the most common being depression and anxiety. The World Health Organization also says that just over 27% of deaths from suicide worldwide are among people age 60 or over, and that is out of proportion with that population worldwide. For more, let's bring in Dr. Alicia English from the Center for Elders Independence in the East Bay. Dr. English, it's great to have you on this afternoon. Thank you for the time. As people start to get older, they oftentimes are more prone to feeling lonely and isolated. How does that put them at greater risk for developing mental health conditions?
Well, human beings are social beings, and it helps our brains to be in contact with other people. And so it's really necessary for us to continue thriving as we get older, to be around other people, to engage in activities and keep the brain engaged.
There is something inherently sort of stressful about the process of getting older. What is it?
Well, I think it's losing loved ones. It's not working anymore because we get a lot of social interaction at our jobs, and possibly moving away. And also our health declines, and we may not be able to get out as much as we used to.
Yeah.
And so that all leads to isolation.
Right, and obviously that's not a good road to go down. Mental health conditions among older adults often go unrecognized, according to the research, and people don't wind up getting the treatment they need. Why is it that we are not seeing that the seniors in our lives might be suffering?
Well, I think they're quiet about it. Often they don't tell us about that they're suffering, or because of the isolation, people aren't around them to see that they are having some difficulty. So it's important to ask.
By the same token, there can also be a stigma around mental health conditions for everyone, but in particular older adults. Does that make people in this group more reluctant to seek care? What do you see at the center?
Yes, absolutely, that's true. And so that's why we bring them into the center and engage them in activities without necessarily talking about mental health or depression. And so just engaging them in activities and checking in with them to see how they're doing. Asking them what they like to do can actually boost their mental health without actually talking about mental health.
It's that simple sometimes. Finally here, as we wrap up, can you give people some advice, some strategies, some effective strategies to support older adults in their lives who they think might be struggling with mental health issues?
Well, I would say go visit them. If you know someone who's home alone, visit them, offer to take them out, engage them in activities.
All right, we appreciate your time, Dr. Alicia English from the Center for Elders Independence in the East Bay. Good to have you on. Thank you.
Thank you very much.
All right, let's take